I'm Colleen Brickle. I'm Dean of Health Sciences at Normandale Community College in Bloomington, Minnesota. I've been at the college for 35 years and have a long history in higher ed here in the Minnesota state system. Well, it's been a long process for me. Many people thought, oh my goodness, legislation passed for dental therapy so quickly in Minnesota. In really the 2 years it was brought forward, it was the perfect storm. For me, it actually began when the first Surgeon General's report came out. He really highlighted the disparities in certain populations that needed care. And then in 2003 came another national call to action by Surgeon General Carbona, and he was the one who really said we really need to address the oral health workforce. The American Dental Hygienists Association really brought it up at a House of Delegates in it was 2001. There was Dr. Marilyn Lowen, who was a nurse practitioner, geriatrics, and Dr. Kate Manahan, who was my dean, but she was a public health nurse. Those two saw, well ahead of many people, the importance of having some leveling or career laddering for a dental hygienist, just very much like a nurse to a nurse practitioner. I think what's really important, they really had what I would call inspired leadership. They shared a vision with me. I could not have done the steps I needed before then connecting with everybody else, because it wasn't the three of us that did everything. But we started it. We also had Dr. Jane Cernahouse and Dr. Suzanne Beatty, who really saw, starting with the dental hygienist, how that foundation was important, that periodontal disease is the one disease that is all evidence-based and truly reflects evidence-based practice, and then combine that with more expanded duties of restorative functions, which actually simple restorations, extractions, and doing more of the restorative care. So that analogy for a nurse to go on to a nurse practitioner is really the foundational piece, knowing that medical dental integration was key to the future, meeting the needs of everyone, not only in oral health, but in overall health. In 2006 to 7, I worked on a new program application with Metropolitan State University, a pathway for degree completion, a post-bac certificate, and then maybe a master's advanced dental hygiene practitioner. And part of it in that time was gathering letters of support, and letters of support came especially from safety nets like Apple Tree Dental and Community Dental Care, and came from even health partners. The Department of Human Services wrote a letter, and we also had some Head Start centers. Advocates were interested in Minnesota, and they came from all across the country to work with us, especially during the second year of legislation. And we listened to them and took their advice, but in the end, we did what we knew would meet our community needs, would meet the needs of the public, and especially too, one thing not looked at is the educational institutions that were going to deliver the care and how they could bring it forward, which is an important element for why some states are struggling to get a program going. They never met with all the key stakeholders. I really wanted to establish this new interprofessional member of the team that would really be educated and trained to the same standards that a dental student is for the scope of practice they would deliver. The whole reason for this bill to pass and the groundswell from 59 organizations was because we were going to meet populations who were underserved, uninsured, access problems, and we really needed to hit those vulnerable populations. So that was critical to me. When it was brought to the legislature, of course, there was some real resistance from some key groups, but looking back on it, in between the first year the legislation passed, there was about a paragraph and a work group was mandated. The process of that work group was very challenging, but it addressed many things that I think really brought to light what the key issues would be for the second year of legislation. And we really looked at populations to be served. We looked at levels of supervision, scope of practice, what educational institutions could deliver the education and training. We looked at accreditation, licensure, and competencies. We looked at how we assess the economic impact, and we'd also look at an evaluation process. But in the end, it was a good process. It was well worth the time and effort. I have always said that I was balancing a lot of different major groups during that time, but it was actually probably one of the most rewarding times for me professionally for my career. Dental access has improved. Dental care is being targeted to populations that deserve it. It's meeting the need. It's very exciting hearing from dental therapists and advanced dental therapists how well they're received in their communities by patients. It's like they're changing. A lot of dentists are more open to it and are asking questions. They're working together. Like I said, every member of the healthcare team and the oral healthcare team is important. It's really fulfilling the goals that were set out. We still have some progress to be made, but we're fulfilling the goals. I think, like I said, it's well worth it, and in another 10 years, it'll be exciting to see where we're at.